So this is Alison, not a real name. Is it Alison? No. She's nodding, but it's not really. So she's come for another shot of steroid to this creaky big toe. You can see the bump on the side. Oh, you see, she's taking all the pictures as well. It's when you get really nice patients that help. So she has got painful end range of motion. She's got relatively good, but a creaky rate. Oh, I can actually feel that crepitus there. Pity you can't hear it, but it's a little bit sore at the end range. So she's had a couple of shots of steroid to this joint. We're trying to avoid surgery for this joint, which will be a fusion down the road. As we pan over to the right foot, this one's not so bad, so we're probably going to give this its first shot next year. Better range of motion, but a little bit of arthritis on the top. So Alison, not your real name, that will be next year for you. We'll get some x-rays done next year. So she's ever so brave, this lady. She's actually on a video and we're doing the injection. We like a 21 green gauge needle to draw up with. That's these, safety needles. We normally use a smaller syringe. 2.5 mils ideal. This one's 5, and the reason I'm using 5 is because there aren't any 2.5. It's as simple as that. So smaller is better. These are Lewis slip, not my favourite, but again we've not got any Lewis lock today. It's one of those days, so we'll live with that. Sometimes it's nice just to check the needle's patent. Kenalog for a joint, my favourite. You're not getting my face in this, are you, Alison? Not your real name, because nobody will watch it. They'll complain. Face for radio, I'm afraid, and that's all the juice. These are safety needles, which I absolutely loathe, but they are kind of safe, and that's it. And we can now put that in your pocket and leave it. Blue 23 gauge to inject with, also a safety needle. So the safety needles, we'll just get all the gas out of that. Safety needles are nice and safe, but they are a bit of a nuisance to use. And that's it, ready to go. You'll hear me talk a lot about doing these under aseptic, non-traumatic touch, aseptic non-touch technique, ANTT. Little click, and then these are ChloraPrep. So it's absolutely key that you do these under sterile technique, and you put on. So it's ChloraPrep. It's Savlon, and well, ChloraPrep's actually a brand name. They're kind of cool. You see those? Loving these. They're just nice and easy. While I used to love to see the iodine does make a little bit of a mess. So ChloraPrep is all what we're about today. So we're just going to prime the needle just a little bit. Make sure it's all out of there. So that's just about dry. We distract and plantar-flex the toe. You see how these safety caps get in the way a little bit. Alison, 3, 2, 1, scratch. And then little press. And that's it. And we'll see if anything comes out of that joint. 3, 2, 1, no. So look how that just milks out. So you want to just put some pressure on that. Keep that steroid in the joint. There's our safety needle. Make that nice and safe. As a plan B, if you've not got the safety needles and you've got your Kenalog there, that's another way of making it nice and safe. Bit of plaster on. We do like a plaster in the health service. These are kind of cute. I can remember how to use them. Oh, they work that way. Just in case you get a little bit of bleeding through. We say to the patients that's going to be 2 days to 2 weeks to kick in. It's a bit of an arthritic joint, so we're not going to get massive improvement long term, but it keeps her comfortable for a period of time until we do a fusion. We now get rid of all these sharp things, and we're good. Thank you, Alison, not your real name.